If you have children, then you already know when they're very young, even the slightest symptom that they may not be feeling well is nothing to take lightly.
Yeah, you can't assume that a sniffle is just a cold or that a cough is just that, a simple cough that will soon go away. Those assumptions can not only be dangerous, but deadly. Your child's symptoms could be a sign of something much more serious. It's called respiratory syncytial virus, or RSV, and recognizing the early warning signs could be life-saving. A couple of weeks ago, new mother Amelia Hudson had a major scare with her newborn.
When we got to the ER, she had stopped breathing. She had turned blue. They put her on oxygen, got her back pink.
She, her husband, and toddler son had gotten sick with a cold virus, then got well. But soon afterward, her 6-week-old Melody spit up. That's when her mom noticed her lungs were congested. Just didn't sound right. They went to the ER. But Melody was soon transferred to the ICU at a children's hospital.
I was scared, but I knew they knew what they were doing.
Melody was diagnosed with RSV, a common winter respiratory virus. Most people of all ages get sick with a cold, but for babies, preemies, the elderly, and sick, it can be serious.
Unfortunately, a healthy child can die from this. It's a very rare occurrence.
Pediatric ICU doctor Kostas Dimitriades says the hospital is seeing more than the usual number of RSV cases now. They don't treat the virus, they treat the symptoms.
If they're blue and they need extra oxygen, we give them the extra oxygen. If the parents are having a hard time clearing out their nose, we help them with that. If they're not eating or drinking enough, then we'll give them IV fluids.
Babies need medical attention if there is wheezing or trouble breathing, if the skin is somewhat blue and the baby is not eating or is wetting fewer diapers. There is not always coughing or fever. After 2 weeks in the ICU, Melody moved to a regular room and is doing much better. Experts say RSV is very contagious, both in the air and on objects, and also children who live around smokers breathing in secondhand smoke are at higher risk of having a more serious case of the illness. So what can you do to prevent your little ones from catching it or spreading it? Jimmy, you have more on that.
Yeah, so Lisa, just moments ago we heard a healthy child can die from RSV. The numbers may actually take you by surprise. Research shows RSV results in up to 10 times as many infant deaths each year than the flu. Get this, nearly 100% of babies contract it by their second birthday. Joining us today to tell us more about it are Lindsay Mathis, a mother whose boys had RSV, and pediatrician Dr. Carolyn Clear. Thank you, ladies, so much for joining us today.
Thank you for having us.
Thank you for having us.
Lindsay, talk to me about your two boys. They both came down with it, Jason and Jack, right?
Jason and Jack. Jason is now 4. He was 4 months when he tested positive for RSV. He started with the cough and wheeze, and Dr. Clear was our pediatrician, and we took Jason to see her, and she recommended that we take him to the emergency room. He did come home with us that night that we took him, came home on nebulizer treatments. Jack was a little bit more serious. Jack was 8 months when he got it. He's now 12 months. He was admitted to the hospital for 3 days on oxygen, on nebulizer treatments, and on steroids. He did come home 3 days later, and both of my boys still have to use the nebulizer and their inhalers when they get the cough, the congestion, and they start to wheeze, so it doesn't get that serious again.
Had you even heard about RSV before?
I'm very lucky. I work in the pediatrician's office with Dr. Clear. I'm a medical assistant there, so I knew a lot of the signs and symptoms to look for, so I have heard of it before, but a lot of women and parents and mothers have never heard of the virus before. They just feel that it's the common cold or it is the flu,
right.
But RSV is very serious.
So how are Jason and Jack today? I mean, they're using the nebulizers, but for the most part, are they okay?
Yeah, they're doing really good. They're doing good. Jason's in preschool and Jack stays at home with us.
Wonderful. All right, Dr. Clear, let me ask you this. Is there any way that a parent can tell the difference between RSV and the flu?
Well, initially, probably not. Initially, it looks very similar. You know, they'll have the common cold symptoms of runny nose, congestion, and cough. But what they need to be on the lookout for was if it turns into a more severe respiratory illness where they see more severe symptoms such as wheezing, trouble breathing, gasping for air, like Lindsay mentioned. They might be very tired, very lethargic, They could have a high fever. Some babies have stopped breathing. Some babies have turned blue around their mouth or fingernails. So any of those severe symptoms would indicate to parents there's something more serious than just the common cold going on, and we want them to seek medical attention obviously right away.
Who's most at risk?
Most at risk are infants and children under 2 years of age, but especially premature babies because they were born with their lungs not fully developed, right. And also children who have chronic lung or heart disease.
And you have a simple checklist that will help us protect our family, is that right?
That's right. So you want to make sure that you're aware of the severe signs and symptoms that I mentioned, that you're also keeping up with your routine well visits with your child's pediatrician or primary care provider so they can answer any questions or concerns that you have about RSV or other common viruses this time of year. And also make sure that you're keeping up with any recommended vaccines, especially seasonal ones like the flu vaccine that your pediatrician recommends this time of year.
Ladies, thank you so much for telling us about this afternoon. Dr. Clear, thank you. Lindsay, before I let you go, if you could boil everything down to one message that you'd like to give to parents, what would it be?
Prevention is key. There's not much that you can do besides the cleanliness and following up with your pediatrician. Early detection is great, but there's also a great website out there. It's rsvprotection.com, and that has all kinds of tips and pointers for parents that if you have any questions, you can go to that website or you can contact your pediatrician.
Lindsay, Dr. Clear, thank you so much for spending some time with us on this important issue this afternoon. Now, if you'd like to read more about RSV, just go to WWOC.com and click on our picture at the top of the page. Now, when our children, or even you, do get sick, have you ever noticed that the medicine to help you feel better can be so expensive? Take Tamiflu, for instance. Even with insurance, it can be pretty pricey. But there are other alternatives that can not only help you feel better, but won't break your budget. Dustin Stone is a father of 3, and when one of his girls caught the flu, he knew it was only a matter of time.
Part of having the kids, they're at school and they're bringing germs home and, passing it around.
All 5 family members were prescribed Tamiflu, but depending on the insurance coverage, that can run you a pretty penny.
We knew it was not going to be cheap when you're getting 5 prescriptions for the flu, but, when the pharmacy told us it was $500, it was kind of a shock.
But some doctors and pharmacists say there are alternatives.
Lift up this arm for me.
Dr. Chad Edwards treats patients with vitamin IVs and nutritional advice.
We find that a lot of people are vitamin D deficient, and there are multiple studies that show that vitamin D deficiency is correlated with upper respiratory infections.
Dr. Edwards also recommends supplements like vitamin C, andrographis, and EGCG found in green tea, things you can find in your local pharmacy or health food store. Pharmacist Chris Schiller recommends that if you don't go the Tamiflu route, to drink lots of water and treat the most serious symptoms.
You've got your Tylenol, your ibuprofens, your fever, same thing. Nausea or vomiting comes along with that. There are things over the counter and prescription that can be used to treat those.
But Schiller says always consult your pharmacist before self-medicating. You could be overdoing it. But regardless of preference or cost, dads like Dustin say, if it helps, they'll try it.
It's one of those, I think your hands are kind of tied situations, especially when you're dealing with your kids. You're not going to, if it was $1,000 for the prescription, you're going to try to find a way to go get it if that's what they need to get better.
Now, medical professionals recommend that if you feel flu-like symptoms coming on, head to the doctor as soon as you can. A lot of people turn to essential oils to help them feel better. After the break, we're going to hear the story of one family who has incorporated the use of essential oils into their daily routine. You're going to find out how they work and if they're right for you. Many claim cannabis oil is the answer to aches and pains. Up next, you're going to find out how a legal alternative is being used to treat everything from severe pain to Alzheimer's. But first, we talked about caring for our babies once they're here. What about before their arrival? Dr. Oz says make sure you choose the right hospital to have your baby.
Hi, I'm Dr. Oz. One of the most important decisions you make when having a baby is deciding where to do it. Now, here's some things to think about. How many deliveries take place in the hospital each year? How is the hospital equipped to handle emergencies? And what's the hospital's style of practice? Will they let you be involved in decision making during delivery?